this presentation on food safety guidelines for post-COVID era based on the Canada perspective. So with reference to that, what I will be covering in the next half an hour is COVID-19 status in the world, in Canada, and our province is Ontario. So our province, what is the situation of COVID, and what is the impact of COVID on the manufacturing and food industry in Canada, and then the role of government organizations in food safety, and then different COVID routes of transmission and what needs to be taken into consideration for food safety and shopping, and then food industry outbreaks. Here in Canada, we have had a lot of food industry outbreaks also for COVID. So I will go through those also. And then the steps to clean and sanitize the machinery in the food industry, what should be done, control of hand sanitizers, disinfectants, and also there's different false advertising, which also needs to be controlled. And then the 6 steps to get your food organization ready for COVID. So this is the worldwide situation of COVID-19. COVID-19, as you now know, worldwide, there are around 27 million cases. And of those, the majority cases are in the US, India, Brazil. And Pakistan has about 300,000 cases. And Canada, as you can see from here, has around 120,000 cases, 130,000 cases now. And we've had in Ontario 2,800 deaths so far. But as you can see, the situation is much better in Canada than compared to the US, although we share a very common border with them. But now there are different situations for food and other items that have been undertaken in order to control the situation. So I'm going to tell you some of the things that Canada has done to control, to reduce the impact of COVID. The current situation of COVID-19 here in Canada, and also this is the comparison. So here you can see from March, US has had actually 2 big waves. So that was the number of cases of COVID. This is the number of COVID cases per million people. So yes, there's more people in some countries. Now this is equaling it out. So in the US, there have been 2 waves. They had about 200 cases per million, and now it's decreasing now. And Canada, here we've had a significant number of cases in about the end of April. And as you know, this is a 14-day gap. So we've had a lot of infections 14 days before then. And Pakistan, it seems as if had a peak in the middle of June, and now it is decreasing. And India has an increasing number of cases per million. However, this data, again, it depends on number of testing. The number of testing in a country is very important also. And I think that there needs to be an improvement in that also. Sorry, let me share the screen again. So there needs to be an increase in the number of testing also, right? So the purpose, yes. So what I wanted to show you here also is that in the case of testing, US and Canada have done a lot of testing. And so in your food industry, it's important for you to also do testing of people as they come in the food industry in your company also, right? So here in Ontario, province of Canada, there are 14.6 million people. It's about 40% of Canada's population. This chart shows you again, like we saw before, in Canada, the high point was about end of April, where we had around 600 cases on a daily basis. Currently, we are lucky so far. It has been around 150, under 200 cases a day. So we are at a better situation now than before. And so the number of deaths also, as you can see, peaked around in the end of April also. And now the number of deaths is about 0 to 5, 1, 2, 3 deaths a day in our province of Ontario. And Ontario province is 14.6 million people. The population of Lahore is 7.6 million. So you can get an idea from there also. But the number of deaths that we've had, 2,800 deaths, of those, 69% have been over age 80. So it has more impacted those people who are senior people. So in your food industry, you need to be careful that if you have older people, they're more susceptible to COVID also. Here, we have had 43,000 cases, of which about 90% of them have been resolved. Those which are not resolved, currently out of 14.6 million people, there are 52 in the hospitals, 15 people are in ICU, and 9 are on ventilators. So as you can see, the situation is sort of under control. Hopefully it stays the same. Now, in terms of food manufacturing in Canada, as you can see, this is overall manufacturing, not just food, but overall manufacturing, the same thing. Everything in March, as you can see, just dropped like a rock. So we had a significant drop in the number of manufacturing sales. That includes everything which is manufacturing, including food also. But food is elastic. There's always demand for food. So food manufacturing, beverage and tobacco, and wood products were the only sectors which actually increased a little bit, and all others decreased when we compare June 2019 to June 20th. So there still has been a very strong demand for food. Of course, people here we had lockdown and quarantine for about 3 months. And of course, I used to only go out for groceries, and everybody else were staying home about 3 months. We had a lockdown. So the impact of that is that here in Canada, our food safety is very important. How do we manage food safety here? We have 3 main organizations in the Government of Canada. One is Health Canada, which develops food safety and nutrition standards and policies. And they assess the food safety risks, right? And the Canadian Food Inspection Agency, so there are provincial and there are federal inspectors. They go out to the food industry and do inspection. The main inspection is done through for meat industry. So I'm going to show you also for meat industry what type of inspections are done and how now COVID has impacted it also. So the CFIA are the main inspectors, and we have a lot of food technologists from Pakistan also. They're working in CFIA also. And then the Public Health Agency, they conduct the food-related illness services, surveillance. If any company, so in the food industry, if there is an outbreak of COVID, then the Public Health Agency, they get involved, and they are the ones who will be managing it. And then we have regional and city levels. We have restaurants and food retailers, spas, etc. They look at that. So far what we know based on COVID routes of transmission. So the main source of transmission is respiratory droplets, which come, of course, from talking, coughing, other reasons, right? So of course, that's why wearing a mask is very important. Airborne spread has not been a dominant factor. So in the food industry, there is circulation of air through HVAC systems. That is important to have a good filtration system, but that is not the only. It has been found in the air that the virus does not travel too far. So that is not it's not a dominant mode, but there is still issue there. Number 3 is very important, transmission through ocular surface. Ocular is your eyes. So the virus can also go into your body through the eyes. So in the food industry, it's important to have masks. It's also important to have face shields also, because eyes are also a possible route for transmission of COVID. And COVID can survive on surfaces and may be transmitted by fomites. Fomite it can be on clothes, it can be on utensils and furniture. So you need to do disinfection regularly. And it also been detected in stools and blood and fecal, oral. So you need to be sure that people, when they go to the washroom, of course, they clean their hands, and other E. coli and other microorganisms, of course, are controlled accordingly. The main recommendations from WHO: isolating and testing. So like I said, testing is very important. If you're not testing, you will not be able to catch all of those who are COVID positive, and you will not be able to understand who you should be monitoring. And then anybody who's positive, anybody they have contacted. So that is called contact tracing. Contact tracing is done here, that anybody who's positive, then they quarantine their contacts. They contact their people in the public health organization. They will contact everybody who they have contacted and quarantine them. And so, of course, physical distancing, hand washing, avoiding crowded places, wearing a face mask. These are recommendations from WHO. Food safety in the COVID pandemic. Right now, there's no real confirmed cases of COVID being spread through food and food packaging, but there is, of course, chance of contamination from people on food packaging. So you can reduce your risk of infection, kill the virus by safe food handling, disinfection, cleaning. I'll come to what is the right way of disinfection and cleaning also. So obviously you need to wash your hands with soap and warm water for at least 20 seconds before and after food handling. So wash your fruits and vegetables with running water. It's also a misconception. You're not recommended to wash fresh food or fruits and vegetables with soap or chlorine or other chemicals. That's not recommended. Fresh produce is porous and it can absorb chemicals, so that is not recommended. Cook your food, obviously, proper temperature, avoid cross-contamination, and disinfect the surfaces. So here in Canada, you might think everything is perfect, but no. Cargill, is one of the largest food processing companies. They have a lot of meat processing worldwide. And in Canada, in April 2020, Cargill meat processing plant in Alberta, they had a severe case of COVID-19. There's 2,200 people in that company. 950 of the staff, they were infected with COVID, and about 800 of their relatives, because they carried the virus to their relatives, the relatives got infected also. 3 employees died. 1 relative of the worker also died, and the plant was shut down for 2 weeks. So you can imagine it's a very unfortunate situation. People died. The plant also lost money, and all the meat also that was wasted. Negative media coverage. There's a $4 million class lawsuit action being done by the relatives that they've been infected, although the staff are covered. So as you can see, in one company, it's such a big issue. And so if you're working in the food industry, it's very important for you to follow the rules and regulations and the precautions to avoid any COVID contamination. And that was in April. Even now, recently, August 14, 2020, there was another outbreak, although now Cargill is using PPE, using masks and everything. Still, in one of the meat processing companies, 5 workers out of 400, they tested positive. In a poultry company in Vancouver, 28 employees out of 71, they tested positive, and the plant was shut down. And in the US also, same problem. COVID-19 has been detected at meat processing plants in 19 states. And so this is a serious issue. We should try our best that it's not going to be an issue in the meat processing companies. Now, why is that? In meat processing, if you look at it, this is the way how meat is processed. So as you can see here, this is how it was before. There's meat on the table here, people cutting it. As you can see, they're talking with each other. There's no masks, right? There's people walking around. There's sharing of tools also. There's nothing in between, no barrier between the people. There's contamination from all over other places. So as you can see, it's not a good situation, right? Now, this is the situation. What most companies are doing now are they have got their plexiglass or plastic separators between people. People are wearing, of course, masks now, and they're wearing face shields also. Like we said, the COVID virus can also come through the eyes also. So you have to be very careful for that also. For that protection is very essential. And then visitors not allowed to walk through all these things. So these things have to be taken into consideration. So I'll wind up in 10 minutes. I just have half an hour. So there's lots of other also COVID outbreaks, and the government of Canada has announced $77 million emergency fund. Our Prime Minister Justin Trudeau in May, he has announced for food processors. The government has approved 32 projects worth $10.5 million. A lot of the different meat processing companies and other facilities are given government funding so that they can implement PPE, the plastic covering, all those other things. They can, get the money and use it there. So COVID-19 is a workplace hazard. For HACCP, when you are going to determine what are the workplace hazards, it must be eliminated. And the way to eliminate that is to limit who is allowed as a visitor. You need to screen staff on a daily basis when they come in with temperature, thermal indicators of temperature. You need to screen them for the symptoms. Anybody coughing, anybody sick, they're not allowed in. Use plexiglass barriers, use PPE, personal protective equipment, sanitizers, do a safety assessment, manage the flow of people and material to limit the chance of contamination. Staggering breaks. Don't let everybody go out and breaks at the same time. You have to say, okay, 20% people go first, then 20%, then 20%. Stagger the breaks. Don't put everybody in break at one time. Make aisles flow in one direction. Even now we go to the stores here and you have to go through the aisles in one direction. You cannot go back the other way. Avoid gatherings of people, of course, not allowed. Now we have a limit here in our cities also. 100 people inside, 100 people outside and 50 people inside a building. Not more than that are allowed. So there's a limit on that also. You need to have a COVID communication board which shows all this information so people are aware about COVID. You need to have training and education on COVID. You need to disinfect all the tools, the buttons, the door handles. Everything needs to be disinfected on a daily basis, on a regular basis. And then the PPE that everybody uses on a daily basis, you need to dispose of that in the proper way. Don't just throw it in the garbage. There's a proper way that you have to dispose of the PPE which may have the virus in it. You have to dispose of that properly. So this is what you need to do in your workplace in the food industry. If you don't do it, then things will happen like that happened in Cargill. They didn't follow these rules and then they had that trouble. To clean and sanitize your place, there's 3 steps. Cleaning, first of all, obviously dirt, you have to clean that out, grease, remove organic substances. Second step is most important, is sanitize. So sanitize is to reduce the level of microorganisms to a level that will not affect this food safety. You can use clean water at 77 degrees centigrade or a chlorine solution not less than 100 ppm or an ammonium compound not less than 200 ppm or 25 ppm of iodine solution. So these are the 4 approved ways of sanitizing. This will reduce the level of microorganisms. And then you need to disinfect. And for that, Health Canada here has approved certain disinfectants which you can use. So these are the steps. So you need to, like I mentioned, remove the waste material, rinse the machine, then you clean and scrub the machine, wash away the detergent. So once you do the cleaning, you wash away the detergent, you look at the equipment, then you wash and rinse the floors, sanitize the floors and equipment at the end, and then you remove the excess moisture because moisture can also get the microorganisms growing. So this is general sanitization. If your food is going to touch this equipment and there is potential of virus on it, you want to do sanitization definitely. In Canada, we have approved hand sanitizers. You cannot just go out and buy any hand sanitizer. Anybody cannot make hand sanitizers in their home. There are 4,400 approved hand sanitizers on the website. If you click on the website, you can go there and put in the name, and every hand sanitizer has a drug identification number, DIN, which is given by Health Canada, or a natural product number, NPN number, and only then it is authorized. You can use that, and it tells you the company, what is the active ingredient, is it alcohol based or not. So that is one thing, that hand sanitizers they must not be expired and they must be approved. Second thing is for the surface disinfectant. So when you're doing disinfection, right now in Canada, there are 499 approved surface disinfectants. So anywhere you're going to put food, you're not going to use disinfectants there. This is not for skin, not for food contact areas. This is, for example, this is what you're going to use it for. Handles. Anywhere people are touching opening doors, you need to disinfect. Anybody touching light switches on and off. Anybody touching handrails where they're walking. anybody pressing buttons on an elevator, these need to be disinfected, right? So this is a simple way to do it. You can make a bleach solution, or you can use one of the approved ones which have a DIN number, and you can use that for the purpose of disinfection. So if you do that, then you will be able to manage these this COVID in the proper way in your food industry also, and generally in the environment. But a lot of people are using false advertising. Mr. Butt was mentioning about the different food ingredients and food products which can reduce potentially the impact of COVID. It's true, but we need to be careful about what are the advertising. Here in Canada, you cannot just say coronavirus protection or coronavirus control. If you do that, Health Canada is going to, they will say it is misleading advertising. You need to have proof of that, and it is not compliant with laws of advertising or marketing. So Health Canada is investigating currently. There are 225 cases of false advertising for COVID, like controlling COVID. Natural health products also are under investigation. So the people should not be misled for that. Okay, I have 5 more minutes. I'll wind up in 5 minutes. These are the 6 very important workplace readiness essentials. In your building, in your food industry, you need to prepare the building properly for returning back if people are going to be working there. The HVAC system, the ventilation system has to be checked. Make sure all the filtration system is good. Clean with products which are approved. Like we mentioned, use approved disinfectants. Prepare plans accordingly. Ensure all the inspections are completed before reopening. So that is one thing, prepare the building. Then second point is prepare the workforce. The people, they need to be also aware about COVID, and they need to be understanding what they can do, what they cannot do, socialization, and if they need to work from home. Here, a lot of big companies, they have allowed all of their people to work from home. They have given them all the facilities to do that. You need to control access. Third thing is control access. Don't let any visitors come in, only those which are essential. You can't let your suppliers walk in your company, walking around. You must do temperature screening. You must provide sanitizers, wipes, PPEs. Create a social distancing plan. So like we mentioned, maintain 6 feet, maintain space, design so that there's plexiglass dividers. Make sure that you have a social distancing plan. Reduce the touch points and increase the cleaning. So using those approved sanitizers in different places, reduce touch points where people can interact or talk or touch same things. So make sure you can do that. Communicate for confidence. Make sure you communicate all this information clearly. These are the 6 steps, and this is just a summary of those 6 steps which are important when you are going to go back to your food industry or to any building, any organization. These are the 6 steps you should be using to return to business. So in your food safety management systems, you have HACCP, you have GFSI, BRC, SQF, ISO. Any of those systems, you need to update your system, and you need to make sure that you have all these things, right? You need to have updated policies surrounding management of crisis, risk management, emergency management, purchasing. All these things need to be covered now because of COVID. It's very important to manage all these things in your food safety systems also. So in the end, I'm just going to wind up by saying that COVID is definitely a big issue for all of us. And some countries, some companies, some areas have been very successful in controlling it, and others have not. So it's very important for us to adopt these good manufacturing steps in food processing operations also. Otherwise, then there will be difficult issues for the company. And these are other points that at the end I just want to mention: stock control, raw material availability of consumables. You have to look at your HACCP plan, make sure it meets all those requirements. Allergens are very important also. Machinery needs to be updated also if you need to do cleaning between shifts also, more time for that. Staff training, like we mentioned, is very important. Staff should be aware of all these different steps. And now we have this at the end, very important point, PPE, personal protective equipment. You need to stress for all the people, frequent hand washing, hygiene, wash your hands at least for 20 seconds, avoid blowing their nose, coughing, sneezing, all those things, right? And gloves are not recommended. Gloves in the food industry for COVID are not recommended. It's recommended to do hand washing. The coronavirus can contaminate your gloves actually. So gloves are not recommended. You should be washing your hands regularly. That is more important because gloves can get contaminated and then they will still create the problem. So in the end, I just want to say that if we follow all these rules, face masks, face covering, social distancing, we can control this issue and we can potentially reduce the impact. Hopefully it doesn't affect our food manufacturing in a more severe way. Already companies have had to drain milk. You might have heard they had to kill a lot of the animals. They had to waste a lot of the eggs. A lot of food actually supply chain have been all disturbed. But if we follow these rules and we are making sure that our COVID-19 does not affect our food manufacturing operations, there is a chance that we can improve the situation further. And this is possible through proper understanding these guidelines and applying them also properly. So with that, I want to thank everybody again for listening to my presentation. I'm going to stop share and you can take over again. Thank you. Hopefully it's been some useful information there.